Early screening is helping doctors at Changi General Hospital pick up cases of lymphedema more quickly. And this is leading to better treatment outcomes. The condition causes painful swelling of limbs and is more likely in people undergoing cancer treatment or those with severe injuries. The hospital has so far found the condition in nearly 3/4 of more than 60 patients it has screened. And for more, I'm joined by clinical assistant Professor Jeremy Sun. Dr. Jeremy, pardon my pronunciation of the specialty area. Now, how bad is the lymphedema situation in Singapore?
Well, lymphedema is actually quite a poorly understood disease, even by patients and healthcare professionals alike. We don't have actual prevalence in Singapore because it's not very examined in Singapore. But we do have some worldwide data. We know that about 1 in 1,000 people around the world suffer from lymphedema, and that is probably an underestimate. If we are talking about local data, we can look into more specific kind of lymphedema like breast cancer related lymphedema. We have some local data on that. In CGH, we have done a study that looks at the prevalence of breast cancer related lymphedema in patients who have undergone lymph node surgery in the armpits and radiotherapy, and about 30.9% of patients suffer from lymphedema after the treatment.
I see. Now you've got with you a camera here. Can you tell us how it works?
Yeah, so this camera is a special camera. It's not like any that you find on the market. It is a near-infrared camera that is used in ICG lymphography or indocyanine green lymphography. This is used to screen for lymphedema. We inject a special dye into the skin of our patients, and the dye is quickly picked up by the lymphatic system. And this camera will show us how the dye runs in the lymphatic system. If you see here, there are little bulbs that shines an activation wavelength. Once that activation wavelength hits the contrast in the skin, it emits a fluorescence that only the camera can pick up. And so if the dye remains in the lymphatic system, all is normal. But when the dye comes out of the lymphatic system into the skin, then it's lymphedema, it's proven lymphedema.
Fascinating stuff. Now, how do patients benefit from this type of screening procedure?
Firstly, we in terms of screening, the first thing we need to do is identify which are high-risk patients. High-risk patients are patients that have already lymph node surgery done, radiotherapy, or have high-energy trauma to their limbs. After being identified, we put them through an education and compliance program so that they understand the importance of their training, of their treatment. And then we put them on a very regular screening program. That means every 6 months they go for ICG lymphography. And then the aim is to pick up the disease as early as possible. And when we do pick up the disease early, we are able to institute therapy early. And that leads to better outcomes and better patient quality of life.
And how long does the whole process take? And how does it compare with alternative methods of treatment?
Well, if you're talking about the lymphography itself, it takes about 5 to 10 minutes to perform. It's pretty simple process of injecting and a quick scan, and then we'll be able to tell whether the patient has lymphedema. Traditionally, we used to use tape measurement. That means we use a roll-up tape measure the circumference of the arm, and then we compare it with the normal side. And that if there's a big discrepancy, then we have to do a diagnostic test after that, usually a radionuclide scan. So the whole process is quite lengthy and a lot more steps involved.
Now, cancer patients and those who have major accidents this year are most at risk. Why is that?
These patients are high risk because they have damage to their lymphatic system. For breast cancer-related lymphedema, they had surgery done in the armpit to remove the lymph nodes, and that's where there's this disruption of the lymphatic system. For high-energy trauma, they usually have an open fracture with a large wound right in the middle of their leg, and that disrupts the lymphatic flow. And that's why they eventually get fluid accumulation in the limbs.
Now, how bad can this condition be for people with serious lymphedema?
It actually is a wide range of presentations. So it can be as mild as just a bit of swelling, a bit of heaviness, but it can also be so bad that a patient can't walk, can't use their hands to do simple daily activities like chopsticks, buttoning. Some patients have chronic wounds that they are so embarrassed to step out of the house because they can't take public transport. I know some patients who actually lost their job because they can't walk. Yeah, so it can be quite debilitating.
So can it be prevented?
Yes, and that is what we are trying to drive the message home at CGH, because with screening, we can detect the disease early. When we treat the disease at an early stage, the outcomes are a lot better than treating an end-stage disease like elephantiasis, for example. Yeah.
So now, because this disease is not really well understood, can someone just suspect that they have lymphedema and just walk up to a doctor and say, I might have this condition?
Well, theoretically, that's possible, but the primary screening doctor will usually screen for any risk factors. So, like I said, if they had lymph node surgery done before, if they had any high energy trauma that actually points to a cause of lymphedema, then yes, they should be referred to us for screening.
So it has to have some sort of, the
Risk
patient
factor.
needs to have some sort of lymph node surgery before.
Usually,
What
yes.
if they present with like unexplained swelling of certain joints or some pains?
Yeah, it is possible as well, and we do get referrals to diagnose to screen for lymphedema in patients where they have just swelling with no identified cause, and leg swelling or arm swelling is very non-specific. It can be due to other causes other than lymphedema, but by doing the test, at least we know whether it is or it is not lymphedema, and then we can focus on other causes if it's not lymphedema.
So thank you so much for joining us tonight, Dr. Soon.
Thank you.
That was Jeremy Soon, Clinical Assistant Professor and Director of the Lymphedema Service at Changi General Hospital.